Dr. Nancy Snyderman is NBC's chief medical editor. Nancy, good morning.
Hi, Natalie.
And the first issue we're going to talk about is one that's been in the news a lot this week, and that's substance abuse in older adults. And this study in particular over binge drinking, which is causing a lot of controversy. And it's more prevalent in adults than we actually thought.
A lot more. It's really defined as 5 drinks at a time. And a lot of people have to remember that 5 drinks could just be one sitting in a month, but that defines binge drinking.
And you know, when we talk about the effects of what that does to the body, especially as you're older, I think we have an email question from Jim in Dallas about those long-term effects of alcohol. He writes, I'm an alcoholic, 56 years old, but I haven't had a drink in 16 years, but have had anxiety and depression and still do. Even though I have quit for 16 years, are there any long-term brain effects I should be aware of for the future?
Well, there are long-term brain effects, and you have to remember that alcohol affects every organ in your body. So that binge drinking means that you can do very risky behavior at the time. A lot of people who are depressed will self-medicate, but remember, liver disease, very common, risk of stroke and other neurological problems, high blood pressure, heart disease, and the profile, Natalie, is different than you might expect. For binge drinkers who are men, usually very successful and single, women usually employed, and the risk with sexually transmitted diseases goes up in both men and women because when you're plastered, you do things you otherwise
much more
wouldn't
risky
be.
behavior, absolutely. Okay, now another study out this week found that drug abuse also is on the rise as well in older adults. Exactly. So are the effects of drugs and alcohol then more detrimental to an adult body than to a teenager?
Well, we know there's this cumulative effect. And if you look at pot and cigarettes, they're both depressive. And so when you self-medicate and when you start to say, well, I want to get high, you have disasters. And we had the Taconic crash recently, which is a classic example of what happens when you self-medicate. But your body is not as forgiving in your 50s and 60s, so it's important to remember that, yeah, you can't necessarily tie one on, smoke a joint, and say, oh, well, I'll function as well or get up the next morning. Body doesn't work that way.
Much more long-term effect there. Okay, and the next health issue that adults, I think, don't necessarily outgrow is eating disorders. We think of eating disorders, we often think young girls,
and
teenagers,
you'll grow out of it.
Yes, but it doesn't end there, right?
Now, this body dysmorphic syndrome, where you really don't like how you look, and you either have bulimia, where you vomit after you eat, or you really don't eat good foods and you calorie restrict in an unhealthy way, which is anorexia.
Or binge eating.
Or binge eating, which is probably the most common at this point, can lead to real problems in life because if you don't get the nutrition you need, your bones get weaker, you can lead to osteoporosis, your skin takes a hit, it hurts your how well your brain functions. So if you want to age prematurely, and then there are blood pressure problems, even a risk of putting your heart under strain, changes in how well your heart beats, not only rhythm problems, but how effectively. So not having your hand around a really good nutrition older in life really makes you age prematurely.
And we have an email related to this from Worcester, Massachusetts. She writes, my mother struggles with depression and anorexia at 48. I myself am a 25-year-old female, and am I headed in the same direction? What can I do to help both her and myself?
You know, she might be headed in the same direction because little girls watch how their moms act. And when moms say, oh, I'm fat, but you sort of know they aren't, or they're displeased with how they look, little girls pick up on that. So if mom's already depressed and doesn't like her body, chances are the little girl may be depressed also and not like who she is. So for both of them, counseling.
And it sounds like she's asking the question at 25. It sounds like she's probably thinking about this a lot.
When you don't like your body, that's not just sort of oh, well, I can't fit into a size 4. It's a psychiatric problem. You can't deal with most of these things unless you get professional help.
All right. Next question. STDs. And this is a huge issue because a lot of women, divorcees, they're out there maybe a little bit more riskier behavior. And
the first time I saw this was about 15 years ago in a retirement community where the women had outlived the men. The women were then going out with men who were younger and had sort of, I would say, some risky sexual behavior. And what did we see? We saw HIV bump up in women over the age of 60. Now, on the surface of that, you would think, well, that can't make sense. But when you're in your 60s, 60s. You don't worry about getting pregnant.
Right.
You say, oh, well, what could happen? He seems like a nice man. And guess what? Your risk is the same if you're 60 as if you were 20. You cannot have unprotected sex if you are not in a monogamous relationship.
And there's some serious health effects
There are
as
serious
well
health. First of all, you could die from,
Right.
HIV/AIDS. But if you're a younger woman, say in your 30s or 40s, you have a big concern about infertility, especially for women in their 30s. Chlamydia is still the #1 STD, which causes infertilities. And also, birth defects is not going to be a big deal for older women. Boy, you have to worry about the cancer risk. HPV causes cancer of the cervix. And again, you may not think you fit the profile to get a really bad STD. There is no profile for somebody who gets an STD.
All right. And by the way, pregnancies in older women can happen,
You can
too.
be 45 and get pregnant. You can be 50 and get pregnant, so don't be cavalier. And then you have to face that very, very difficult decision. Oh, I'm 50 and pregnant. What do I do now? Don't let yourself get in that position.
Right. Okay, finally, depression. This is a big one for a lot of people, huge issue. And really, I think everybody needs to be thinking about that.
We've talked so much about teenagers being depressed, but it's important for women after pregnancy or around perimenopausal times, you can actually have a clinical depression. There are a lot of great medicines out there now, as we've talked about, that can help with depression, but the best treatment for depression is therapy and medication. And we're in a little bit of a pinch right now in society because insurance companies pay for the pills, but not for the therapy. But depression is real and can affect every other health problem that a woman has later in life.
We have somebody on the phone, Yolanda from Birmingham, Alabama, who has a question for you, Dr. Nancy. Go ahead, Yolanda.
I have an 83-year-old elderly father who's suffering from a bout with depression, and his diet is very poor, mainly junk food and milk. What role does diet play in depression with the elderly?
You know, it's interesting, Yolanda, that you even mentioned your dad's age, because a lot of our dads, as they get older, life seems to be slipping away. They lose their interest with food, so they don't eat as well.
So true.
So if you don't have good nutrition, your brain doesn't work as well. And I think the elderly and depression have probably been the most skipped part of society. There are antidepressants, Yolanda, that your daddy should talk to a doctor about that don't have the big side effects as some of the other ones. But people in their 80s who suddenly don't sleep well, have the blues, don't see real purpose to life,